Hi, my name is Lisa. I'm here doing my health assessment. This is going to be a video of a full head-to-toe assessment here today. For purposes of this video, you're going to get a 360 view of the room. These are some of the tools I'll be using throughout the assessment today. And I'll begin from here. Hi, my name is Lisa. I'm going to be your nurse today. Can I just confirm your name and date of birth?
JAG 92071.
Perfect. I'm just going to get my hands washed here. And can you tell me where you are today?
Medical facility for a head-to-toe assessment.
Perfect. Do you know the year and who the president is?
2024, President Biden.
Perfect. Do you remember what you did to celebrate your last birthday?
Yes, we went out to a very nice dinner and to a show.
Perfect. I'm just going to have you take this piece of paper and do as it's instructed here, okay? And just for the video, I'm going to leave it out here. So the paperwork does say take this piece of paper, hold it in your left hand, fold it in half, and place it on the floor, which the patient did do. Couple number tests that I'm going to do with you here. Can you count backwards by sevens from 100 for me?
100, 93, 86, 79.
This test would be conducted for
65.
an entire minute, but given the time constraints, I'm just going to end it there. Next, what I'm going to have you do is listen to the 4 words that I give you, and then you're going to count backwards from 20 for me. The cat, dog, pool, and grass. Can you please count backwards from 20?
20, 19, 18, 17, 16, 15, 14, 13.
And again, for time concerns, we're going to stop there.
Cat, dog, pool, grass.
Perfect. Thank you. I'm going to just go ahead and get a blood pressure and the rest of your vital signs, okay?
Okay.
(122/72). Perfect. I'm going to have you just place this on your finger so I can assess pulse ox and pulse here. And I'm just going to get a temperature. 98.2. Oxygen level at 98 and a pulse of 80. Perfect. All right. From here, I'm going to be starting with the full head-to-toe assessment. So I start off by observing and looking at the full head, making sure there's no lumps, bumps, moles, anything of concern. It is symmetrical, no problems there. I do note balding. Is that normal with your genetics?
Yes.
Okay, perfect. Next, I'm going to just take a feel of your temporal pulse, and then I do have to listen to either side, okay?
Okay.
2 plus either side. Great. I'm going to move down and just take a look at your ears here, and I'm going to feel them out as well. Both sides are symmetrical. No lumps, bumps, or anything noted. I'm going to whisper into either side of your ear if you can just repeat what I say.
Lamp. Hello.
Okay, next I'm going to take a look at your eyes. They both appear to be symmetrical as well. I'm going to just feel up above and below for just a second. Just palpate around here. Take a look at the sinuses. Good. I'm going to take a look into your eyes for your pupils. Just make sure they are equal and reactive, which they are. Next, I'm going to have you just follow my finger for me. Perfect. Just take a look at my finger here. And he accommodated very well. At this point, I do not have a smell chart to have him visually look at to perform this test. A chart would be hung. He would cover each individual eyes at separate times and read either the letters or the numbers that he's being asked to see. I'm just going to go ahead and take a look at your nose here. And again, that is very symmetrical. Take a look up each ear, no drainage or anything seen that should be noted. Take a look at your nose. I'm going to palpate either side if you would just breathe normally. Good. And then to look at your mouth, no cracks or anything bad seen there. I'm going to have you open your mouth just so I can take a look at the oral mucosa to start with. And if you would just stick out your tongue, move it up, down, left, right. Can you say ah for me? Good. From here, I would also be doing a test of the gag reflex, which would be using a tongue depressor towards the back of the throat. But we're not going to do that right now. I'm going to be just looking at some sensations on your face here as well, and just tell me what type of sensation you feel, whether it's soft or hard.
Soft. Hard.
Great. For your nose, I did forget one thing. I have a smell that I need you to do for me. So if you can close your eyes and just let me know what the smell is.
Coffee.
Great, thank you. Another thing that I'm going to do with your face here is I need you to purse out your lips. Great. Can you smile, frown, puff out your cheeks, and I'm going to just apply some resistance. Excellent. Good. From there, I'm going to take a look at your neck. There does not appear to be any jugular vein distensions. I'm just going to take a feel for any kind of lymph nodes. Take a peek under your arm here really quick for that as well. None noted. I do have to feel for your carotid pulses, which I will do on either side, not at the same time, and then I do have to listen to that as well. 2 plus either side. One last thing before I move further down to your shoulders, I just want to check for any kind of TMJ that you might have. So if you would, can you clench down really tight for me? Good. And can you move your jaw to side? No TMJ noted. Okay. Can you shrug your shoulders up and down? Good. I'm going to just go down your arms, take a look at the skin coloring. Skin color looks good on either side. There doesn't appear to be any kind of moles or lumps, bumps that I need to note on here. I'm just going to put my hands on your brachial pulses just to check those bilaterally. And the same for your radial pulses. Can you hold your arms out, and I'm just going to have you rotate your wrists inwards, outwards, up and down. Good. And now, perfect. Just to move on to your fingers, I'm going to just check for some capillary refill bilaterally. Less than 2 on both sides. And just to check your skin tartar here. Good. Good. Okay. I'm going to move on to your chest. I'm going to start by listening for your heart sounds. It's going to be aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to listen to it 2 times. The first eye will be with the diaphragm of my stethoscope to listen for S1, S2 sounds, and then I'm going to be using the bell to listen for any kind of abnormal other sounds of your heart. Okay?
Mm-hmm.
That all sounds good. Next, I'm going to be listening for your lung sounds. So we're going to start in the front, and then I'm going to go to the back. But before I do that, I do want to percuss on your chest first and foremost. Okay. Typically, for any of these tests that are done on the chest, the shirt would be removed, but because of this video, we are not removing it for any of this. So just to start with some percussion here. Okay, and then just to listen here for a moment. Can you breathe in and out for me? All right, I'm gonna have you just turn around for the camera for me so this way I can do the same to your back. Here there's gonna be 7 areas in which I'm going to percuss, and then 9 areas in which I'm going to listen to. And from here, I'm just gonna listen. Can you take some nice deep breaths for me as I go through this? Lung sounds are clear, no crackles, wheezings, rhonchi noted. While I'm back here, I'm also going to check for fremitus, so I need you to just go down and say 99 for me.
99, 99, 99, 99.
Okay, and then I'm gonna do lung sounds the same. I need you to say 99 for me throughout your lung sounds.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect, thank you. While he's facing us with his back, or just assessing, making sure that the skin looks perfect here as well. And I'm not seeing anything of any concern. Would you just turn around back here for me again? Thank you very much. Can you just do one more thing with your upper neck for me? I'm gonna need you to just turn left, right, up, down, and just move your ears side to side. And then just press left and right. And then just to check for strength, we're gonna do it again. I'm just gonna have you push into me, away from me, into either side. Good strength on both sides. Okay, I'm gonna take a look at your belly, do a listen. So if you would, I'm gonna have you just lay down. So for this, with an abdomen, just to inspect it first and foremost, making sure that there's no real abnormalities seen. I'm gonna have him just lay there. We're gonna inspect the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant in that order. First by auscultation. Good, bowel sounds are noted. From here, I'm just gonna percuss 3 areas in all 4 of those quadrants. Good. And then some light palpation while I'm here, okay? Any pain in your abdomen as I'm pressing down?
No.
Okay. The other thing that we're going to listen to while we're here is the aorta and the kidneys as well. Okay. I'm going to just palpate for your femoral artery, and then I'm going to have to listen to both of those as well. All right. Moving down the legs, just again, check the skin. Coloring is good. Texture looks to be okay. No bumps, moles, lesions, anything to really be concerned with. To start with, I'm just gonna do, if you can just put your knee upwards for me, bend at your knee. Perfect, and same with this side. And I'm just gonna test a little bit of strength. Can you push up into my hand, and then try to push down? Same here, and same here. Good. I'm gonna have you just put your legs straight for me. Good. And this one as well. I just need to check for your popliteal pulses here. And good. All right. gonna have you do a couple of rotations with your hip for me. If you can bring your leg up. And I'm just gonna have you actually move your hip outward for me. So if you could just put your leg out, extend it past the table. That's one. Okay. And then if you can do that on this side as well, just extend outward. Good. Gonna have you just lift your leg for me and push down. Good. And then just yep, I'm gonna need you to just swing that right under there and put it back. And then I'm gonna do the same to this side. Just lift your leg up, push down, and then just swing the leg. Perfect. Good. Okay. I'm gonna just take a listen, take a feel of your tibial pulses and your dorsal pedis pulses. Can you just rotate your ankles inward and outward for me, up and down? Good, I'm gonna have you push up on my hands, down on my hands. Good. I'm just gonna check the toenails for capillary refill as well. And just, good, also. Can you just squeeze your toes in and just open them wide up? Perfect. Good, just like that. Okay. Can you sit up at the side of the bed for me? Awesome. I'm gonna have you with your hands do a couple of rapid motions for me. Can you just go up and down like this? Good. Okay. All right. I'm gonna have you stand up and we're just gonna do a couple of those tests as well. But can I actually, one more thing, I'm very sorry. A couple other tests that I just wanna do really quickly on you. I am going to be putting objects into your hands. If you would just close your eyes and just tell me what the objects are.
Key,
Good. And this one?
quarter,
Good. Thank you. I'm going to be drawing a number into each hand. If you can just tell me what that number is.
6, 4,
Yes. Good. And while I'm doing this, can you tell me what kind of sensation you feel here
sharp,
and here?
soft,
Good. And here
sharp,
and here.
soft.
Good. Okay. If you would just stand up for me. And a couple different things that I'm going to look up here. Well, I have you standing up and I can look at your chest, on each side. I'm going to have you just take a nice deep breath for me. Good. Good chest expansion. We're not seeing any kind of barrel chesting, so at least we're getting a nice visual on that. I need you to close your eyes and put your arms out in front of you. We're checking for any kind of drift, which I am not seeing. At the same time, we're also looking to make sure he's not doing any kind of swaying motions, which he's not. So those all look good from that point. Okay, that's it. Can you do me a favor and just run your heel from your knee to your shin and shin to knee? Perfect, and other side as well. Good, thank you. I'm just going to take a look at some of your walking. If you would walk back and forth to the door for me. And on your way back, can you walk on your tippy toes? Good. And then I'm going to have you turn and walk on your heels on the way there. And then do your heel to toe for me. Good, perfect. Can you, while you're standing, I just want to check a little bit of your range of motion in your back. Can you bend down and touch your toes and stand back up? And can you go back, kind of flex backwards a little bit? Good, awesome. And just to make sure that I didn't miss it, can you put your arms out and do a rotation for me? Good. Okay. And you can put your arms back down by your side. All right, you can come back and have a seat here. And I think that's going to conclude our exam. Do you have any questions or concerns for me right now?
Nope.
Perfect. Thank you very much for your participation.
You're welcome.
Thank you.